Okay, thank you very much, everyone, for joining this Circle and Sustainable Care seminar, which is going to be about finding and funding social care. And I'm delighted to welcome Dr Kate Baxter from the University of York. My name is Sue Yendall. I'm the Director of Circle, the Centre for International Research on Care, Labour and Equalities at the University of Sheffield. And a number of you on the call are familiar with the Sustainable Care Programme, which I currently direct, and some of you are members of that. Kate is Senior Research Fellow in the Social Policy Research Unit at the University of York, and many of you will know that SPRU at York has been an incredibly important focus of some excellent and important research over many decades in this field, and so it's a great privilege to have Kate with us. So without more ado, I'll turn over to Kate.
Thank you. So I'm Kate Baxter. Hello, and thank you everybody for joining today. And as Sue said, I'm going to talk about our research about the experiences of self-funders. The aims of this study were twofold, really: to learn more about the experiences of self-funders, and also to contribute a section on self-funders' experiences to a website called Social Care Talk, and that website will be launched later on this year, and it will contain public-facing outputs, primarily in the form of short film clips of people talking about their experiences of social care. And I'll explain more about that as we go through the talk. So this is the study team. Between us, we've got experience in practice and in research. We have knowledge of adult social care, of finances and family finances, and of producing peer experience and public-facing outputs. I'm not going to go through everybody, but I'm just going to mention a couple of names. So Lindsay Lindley is the researcher on the project. So she's been doing all the interviews and the bulk of the analysis and writing, and she's here in the audience, so she can help out with the discussion later on. And the other name is Adam Barnett. So he's from the DIPEX charity. And DIPEX is the organisation that is building the Social Care Talk website that we'll be putting resources onto. So DIPEX disseminates research for public benefit, so public-facing outputs. They've been doing this for around 20 years, mainly through a website called Health Talk. So Health Talk is about people's experiences with health conditions. Social Care Talk will do something similar, but for people's experiences with social care. So the aim of the website will be to help people to feel better informed, better prepared, and less alone in the journey that they're making through their social care experience. And again, I'll show you a bit later what Health Talk looks like, so you'll have an idea of what it is that we're aiming for with Social Care Talk. So this is what I'll be talking through: a bit of background about what we mean by self-funders, what we already know about self-funders, the study aims and methods, and a little bit about Social Care Talk. Then the findings of the study, I'll be talking about them by giving an overview of the topics that we will be presenting on the Social Care Talk website, and then a little bit more detail and some quotes from two of those topic areas: family and friends and understanding money matters, and then just a brief summary and our next steps. So first of all, what do we mean by a self-funder? We're talking about people who pay for all of their social care and pay for it from their own resources. So not people who are using direct payments to pay for care, but people paying out of their own savings and assets and income. And they're not receiving any kind of financial contribution from the local council. So it may be that people have had a needs assessment by the local council and their needs might be high enough to be eligible for a council contribution, but the financial assessment that they subsequently have shows that they have more than the current threshold, which is just over £23,000 in savings and assets. So it's that group of people paying for their own care. Or people might have chosen not to go to the local council for a needs assessment and just assumed that they have sufficient finances to pay for their care. So that's who we're talking about. So what do we know about self-funders from research already? Usually they're older people, not always, but typically older people. Basically, that's because old people have had the chance to build up those resources throughout their working lives. There's also a lot of people who are self-funding their social care. Accurate estimates of the numbers of people are hard to come by, but the estimates I know of suggest that there's around 40 or 50% of people in care homes who are funding all of their care, and for home care, somewhere in the region about 25% or so, although that figure's a little bit old, that are self-funding their care. But the point is that there's a lot of people. We're not talking about small numbers of people here. They're a big chunk of the older population who are using social care. We also know that people, self-funders, don't really have a very good understanding of social care. Same as members of the public in general, people tend not to think about social care until they actually need it, until they or a family member need it. And then it's a scrabble to find out how the system works and what will be appropriate. So poor understanding of social care. And self-funders feel comfortably well off, but not particularly wealthy and not super rich. Some people do have a lot of money, but for a lot of people, having more than just over £23,000 in savings and assets isn't a huge amount for older people. And if people have 50, 60, £80,000 worth of assets, that will soon go on social care. People underestimate the cost of care. It can be quite expensive, so a care home place can cost between £25,000 and £35,000 a year or more, depending where you are in the country. And for home care, around £20 an hour or more, give or take a couple of pounds. So it is expensive, and people are quite shocked when they find out how expensive it can be. We also know that people self-funders struggle to find information about care and information about paying for care. And that's not necessarily that there isn't information out there, because there is a lot of information out there on websites and with local councils or voluntary organisations. But it's about not knowing how to look for that information, not knowing where to start, not knowing what search terms to use, not knowing what questions to ask or who to ask them of. And when people do find information, sometimes they can find so much that it can be somewhat overwhelming, and trying to figure out what is the best information for their particular situation, what is trustworthy, can be quite tricky for people, quite a challenge. And we also know that self-funders want personalised advice, not just information. So recommendations about what would be right for them, or reassurance that they've looked at the right type of information, and reassurance that they've made the right decisions for themselves or their family member. I just want to briefly mention a couple of projects that we have done at the Social Policy Research Unit over the last few years, funded by the School for Social Care Research. One was about the information needs of self-funders, and one about financial advice about funding care in later life. And some of the findings from these two projects are what prompted us to develop and undertake the current project. And those findings were that self-funders rely very much on their friends and their family for information and support. Word of mouth is very important. Trust is very important. So people's networks and their social contacts are key. But of course, different people have different size networks, and even somebody who has quite a large family or social network, the experiences that people within that network have of social care are not necessarily great and not necessarily relevant for that person. So trying to rely on learning from other people's experiences can be limited and challenging for some people. So by contributing these resources, as we intend to the Social Care Talk website, we're in effect increasing people's opportunities to learn from other people's experiences. And the other issue that these projects highlighted for us are the amount of anxieties and the range of anxieties that self-funders have about paying for care and about seeking financial advice about paying for care. And I'll just run through a few of those just so you have an idea of the kinds of concerns that people have. So these are the common anxieties people have. They worry about how much care is going to cost. They are concerned about how they're going to manage to fund to pay for the care that they need. Often people had plans for their savings, typically leaving an inheritance for the family. So they're concerned about spending that money on care and having nothing left to leave. People worry about what happens when the money runs out, then what happens to their care and their situation. They worry about having to sell the family home. And they are reluctant to ask for financial advice, partly because they're not really sure what financial advice can do for them in relation to paying for care, partly because not everybody typically talks to a financial advisor, so it's quite something different for people and something that they don't necessarily feel comfortable with. So it was those two things, the reliance on peer networks that aren't necessarily huge or effective, and these concerns about paying for care, that led us to develop the current project. So I'll get on and talk about this project, Finding and Funding Social Care. The aims, just to reiterate, were to improve understanding of self-funders' experiences of finding and funding social care, and to provide resources for self-funders, for the relatives, and also for professionals by publishing these peer experiences in different formats, written, audio and film, on the website Social Care Talk. Now, because Social Care Talk isn't developed yet, it's being built as we speak, I'm going to show you what the Health Talk website looks like, because Social Care Talk will look very similar. So these are screenshots taken from the Health Talk website. So in the top left, that's the home page. It's about real people talking about real life experiences. And then if you go into the home page, into the website, there's an A to Z, and there are about 100 different health conditions on this website. And each health condition has its own set of pages within the site. And in those web pages are film clips of people talking about their experiences, and those film clips are grouped into key topics. So on the right hand side of this screenshot, I chose to look at carers of people with dementia. So there's a list there of the key topics. So in the research that was about carers of people with dementia, these are some of the key topics that people spoke about. So there's a number of them underneath diagnosis, about suspicions, signs of dementia, diagnosis, tests, genetic testing, and it goes on to treatments and then experiences of becoming a carer. So they're the kind of key topics that there are here. You can then on the website click on any of those key topics, and that will take you to a written summary of that particular topic and some video clips of people talking about their experiences. So pages that look similar to what I'm showing you now. Video clips are typically a couple of minutes, 1 to 3 minutes long, of people talking about their experiences. And as I say, the written text that you can see on here is just a summaries linking together those different people's experiences within that topic area. So I just want to reiterate that everything on Health Talk, and the same with Social Care Talk, is based on research. So this is what we're aiming for, something that looks like this, based on our self-funders research project that we're doing now. So this is an outline of our project and what we've been doing. So there are 3 stages to the project, 3 work packages. Work package 1 was about planning and engagement, and that's been ongoing throughout the project, and that's involved our project advisory group. We have a small public involvement group, and we've run some focus groups as well, and that's about engaging appropriate audiences. And also the focus groups early on in the project were looking at what people felt would be the appropriate content for this self-funders section on Social Care Talk, and how they would like that section to look and feel. Work package 2, which is the bulk of the project, and really what I'm talking about today, is qualitative interviews with self-funders or their carers. We were aiming to talk to around 40 people, and then analysing those interviews thematically, and then writing the topic summaries. So that's the written summaries of the main topics people spoke about, with the video clips within them. And then the creation, the building of the self-funders module. And then work package 3, a formative evaluation. So that's market testing the demonstration version of that self-funders module. So the stage that we're at the moment is over the last month and through to next month, the self-funders module is being created. So the Dipex charity has all the materials to create that those pages for the website, and then we'll be testing them in April. So just a little bit about the methods, the interviews and the analysis. Just reiterate, the interviews are filmed, so not just audio recorded, they were filmed as well. The interviews were of a narrative style, so that meant that the interviews began with fairly open question, asking people just to talk about their experiences with self-funding or their parents or whoever it was they were talking about. And that gave the participants a chance to prioritise what was important to them before Lindsay then went on to ask them, to prompt them to talk about other aspects that we were interested in, mainly around paying for care and around financial advice. The analysis, thematic analysis, we were looking to have about 20 to 25 key themes, so key topics to go on the web pages. We ended up with 23. I have to say, to begin with, I thought looking for 20 to 25 sounded a little bit prescriptive. And initially with our analysis, we had, I think it was 33 or 35 different topics that we felt were key. But actually, when we began to write them up and develop them properly, that reduced, and we have 23 topics in our final version. So our next stage after analysis was to write the topic guides, and these are plain English topic summaries, sorry, not guides, plain English topic summaries, because they're aimed at members of the public. So each topic summary is around 500 to 800 words and contains around 10 to 15 short film clips of participants talking about their experiences. And throughout all of this analysis and writing, our project advisory group and our public involvement group were fantastic, and they have helped us develop those summaries, made sure that we've written them in plain English, made sure that we are telling stories within those summaries that make sense, and with some of the more factual information about adult social care or about financial services, to make sure that we've got that right. So moving on to findings, so I'll just tell you a bit about the people who took part, and then go on to talk through the headings and the main topics that we have that we'll be presenting on the Social Care Talk website. So the characteristics of the sample, we were aiming for 40 people. We've actually interviewed 29 people. These interviews were planned to take place in the first 6 months of last year. So Lindsay had done an excellent job by middle of March last year in interviewing 19 people, but then of course the world changed, so things became a bit, we had a pause in the project and then restarted. So we've ended up with 29 people, 22 female, 7 male. 2 people were self-funders themselves, but most people were carers of people who were self-funding. So 6 people who were spouses of a self-funder, and 21 who were helping their parents who were self-funding. 19 of those interviews took place face-to-face, 9 were done on video calls, and 1 was a telephone-only call. Of the interviewees, they were aged between 40 and 92 when the interviews took place. And the people they were talking about, so the self-funders they were talking about, were aged between 65 and 95 when they began to pay for care. So not necessarily at the time of the interviews, because some people may have been paying for care for a number of years by the time the interviews took place. And people lived in, the self-funders lived in a range of accommodation, from in their own houses through to sheltered accommodation and care homes or retirement villages. And they were in many different places throughout England. So these, moving on now to the main topics that are included on the Social Care Talk website, we've got these main 9 headings. So the first one, overview and terminology, I hope is fairly self-explanatory. So that's just an overview of what the web pages contain and how we've used different terms. And then the last 2, resources and credits. Resources has a page where it links to other websites, 5 or 6 other websites that may be useful for people who are self-funding, and the credits are the acknowledgements and thank yous. So these other 6 headings, getting the right care, understanding money matters, assessments and eligibility, information and support, family and friends, and legal matters, are the main headings under which we've put our written topic summaries and video clips. So the numbers in brackets after each of these headings are the number of topic summaries under each one of those headings. So I will talk you through those now. So the topic summaries. So under getting the right care, and I should say actually we hope that these topic headings, the summaries here, are fairly self-explanatory, because the aim is that self-funders and members of the public looking at the website will be able to look at these and choose which ones are appropriate to them in their current situation. So under getting the right care, we have what type of care is available. And I should emphasize again that these is people talking about their experiences. This isn't us telling people or advising people about what type of care is available. It's people talking about the range of care that they have experience of. And it does cover a full range of different types of care, right from just having a bit of help with cleaning in the house or in the garden, through family care, right through to care in a care home. So what type of care is available? Thinking about future care needs and costs, keeping track of care needs, managing care at home, choosing a care home, moving care homes, and complaining about care. Just a little bit about, I won't go through all of these in detail because we don't have time, but the thinking about future care needs and costs. For me, one of the key issues that is in that section is that people find it quite upsetting to think about future care needs and the costs of their future care. Many people in this sample didn't plan ahead for their care as much as they thought with hindsight that they could have done. So their advice to people reading this website is to think about it sooner than you think you need to. Don't leave it too late until you hit a crisis point. Excuse me. So moving on then to understanding money matters in the middle column. So the topic summaries within this section are ways to pay for care, benefits and other help with funding care, taking financial advice about paying for care and what is an immediate needs annuity, and then what happens when the money runs out. So just a couple of things here with the benefits and other help with funding. The issue for me that stood out here was how difficult the adult children of self-funders found it to fill out some of the claim forms, so a form for attendance allowance or other discounts, and actually having to think about and write down how their parents were struggling with day-to-day activities. And that was quite difficult and quite challenging for the adult children to accept that and to think that concretely about how their parents were aging and struggling. Excuse me, well, let's have a drink. So then, taking financial advice is fairly self-explanatory. What is an immediate needs annuity? I'll just explain what an immediate needs annuity is, because you need to know this later. So it's a kind of financial product that helps people to pay for care, and it works by people putting forward putting down a lump sum payment, which then pays them back at a smaller rate each month for the rest of their life. So it's a bit like a back to front insurance policy. So a big upfront lump sum in order to get a monthly payment for the rest of their life to pay for their care. And its purpose is to take away the worry and the stress about exactly how much care is going to cost, because you've paid that up front. And in that section, we have a small video clip from a financial expert just explaining what an immediate needs annuity is, before we then go on to people's experiences. And under assessments and eligibility, we have what is a needs assessment, what is a financial assessment, what is continuing healthcare, and each of those also has an expert explaining what they are first, before we then go on to people's experiences. And the final one in that section, challenging decisions about care and funding. Then we have information and support, and under that we have information from local councils, other sources of information, so that's about searching the internet, that's about voluntary organisations and about local support groups and face-to-face groups where people can find information. And help for carers. A lot of people in the study were carers. 27 of the 29 people were carers. So that came out as quite important for people to talk about their experiences of finding help for themselves as carers. And again, voluntary organisations and support organisations came out strongly then. Family and friends, we have a section on how paying for care affects families, which I'll show you some quotes from that section in a minute, and people's experiences of looking after other people's money. And then finally, in legal matters, we have a section on lasting powers of attorney and on wills. And again, just a reminder, this isn't us advising people to do these things, this is people's experiences of taking out lasting power of attorneys or wills, and the reasons why that came up with self-funding, paying for care, and their experiences and the appropriate timings for doing that. So I'll just, on these final few slides, just show you some quotes from people just to illustrate the types of things that people were talking about when they were talking about how paying for care affects families, and then just a little bit about financial advice. So in the topic summary about how paying for care affects families, one of the key issues was around inheritance and the emotional aspects of people wanting to leave an inheritance but being worried that the money was all being spent on care and they wouldn't be able to. And what came out of this is that actually it was the parents, the self-funders themselves, that were most concerned about this and most upset about the money disappearing on care, rather than the adult children who would be in receipt of that inheritance. They were, at least they told us, that they were less concerned about that, but they were more concerned and upset on behalf of their parents rather than for themselves. So here we've got Sinclair, who's one of our self-funders, who's saying the only disappointed one really is me, because I had plans to leave them, his children, much better off than I started, and it's not going to happen because he'd spent that money on care. And I should say, if I was being clever, if I was clever here, I would be able to show you the people actually talking about this themselves. But I've just got the quotes, so it's just me reading the quotes. But these are the types of the filmed experiences of people talking that will be on the website. So that's Sinclair, and then we've got Sally, who talked about her parents who are both self-funding, and she says, I can't emphasize strongly enough how dreadful their reaction would be if they'd known, and they never did know, and it's something I've just got to live with. And what they didn't know was that the money that they had planned to leave as an inheritance had all been spent on care. So Sally had made that decision not to tell them that because they would have been too upset by it, and that's something that she has to live with, knowing that her parents had passed away and she hadn't told them that. So the next issue in how paying for care affects families is about discussions within families, and the paying for care adds an extra dimension to these family discussions. Deciding whether to bring in external carers or for somebody to move into a care home is going to be challenging and difficult for any family. So it's going to involve family discussions, but the added dimension is the paying for care element. So Paula here, she's saying that actually what worked for her, so she's saying the other thing that's worked to my advantage probably, and it's a double-edged sword, is that I'm an only child, which means that it's been on me to sort out, which has been hard, but I don't have the sibling friction. So she's kind of felt lucky that she hasn't had to have these family discussions with her siblings, because there hasn't been any, so there wasn't any falling out about decisions. But on the other hand, she's had all the responsibility to make the decisions herself. And here we have Mark, who's saying basically what we had to agree on was that effectively my dad was going to leave us no money, so that's going back to the inheritance issue. All of his money was going to be used up in his care, and luckily I'm close to my brother and sister, and we all completely agreed. It wasn't always as rosy as that, so there was an example of a step family. So it was the dad who needed to move into a care home, and his wife had arranged for that and arranged to pay for that within their financial limits, so what they could afford. But the father's sons, so the wife's stepsons, actually wanted a different and more expensive care home. So it made for challenging conversations within the family about what was actually affordable. And then the other issue in how paying for care affects families is about balancing when to provide that care within the family and when to decide to pay the money or the extra money for formal external care workers. So here Frances is talking, so her dad lived with her and her family, and when she's talking about it here, he had just gone to a care home for respite care temporarily. So what she has to say is that I'd approached a care agency for night care, but it's double the cost. So at the time, we were paying £18.50 an hour in the day for care workers, and that rose to something like £34 in the evening an hour, and that was just, we couldn't afford that. Then her father went into respite care, and she says, I think it was when I watched half an hour programme without being disturbed, I ended up hysterically crying, realising that we hadn't ever done that for a good year, if not 18 months. We hadn't ever chatted to each other. We hadn't done anything as a family. So her father had been living with them, and they were struggling with this debate about, do they pay £34 an hour for evening or nighttime care so that family could have some free time, and decided that was too expensive. But it just came to a crunch when her dad was in respite care. She realised that actually maybe it was worth spending the money after all. And somebody else was saying it was quite liberating to realise that the money was there for care. All you have to do is give yourself permission to pay for it. And as I say, it's a liberating experience to realise that you can use that money that's been saved for a rainy day. So just the last couple of slides here. So about the topic summaries under understanding money matters. So I just want to show a few short quotes about people's feeling about financial advice, just to show the range of different feelings that people had. So here we've got Peter, his wife was self-funding, and he had to say, I do not trust financial advice unless it's something from a large organisation, so a big branded organisation. Local blokes selling financial advice, I do not trust. And that trust issue is quite key, I think, that people do. They don't know what to expect from financial advisors, therefore they just trust the big brands, but not the local firms, blokes or women. And Andrew, he's saying, interest rates are poor, so poor at the moment, what's the point in investing? We don't want to gamble with the money. And there's 2 points there. The gambling with the money, so that's the risk issue about taking financial advice and investing money. But also there's an issue here about people having responsibility for somebody else's money. So it's not Andrew's money, it's his mum's money. And he doesn't feel comfortable gambling his mother's money by investing it. And then in contrast to that, this is Rosemary. Her husband was a self-funder, and she had spoken to a financial advisor for advice before hitting a crisis point. So she had to say it was reassuring speaking to the financial advisor. I didn't immediately go into blind panic mode when I knew that my husband needed to have more care than he could get at home. So when it was time for him to move to a care home, she didn't panic. She already had plans in place, so knew that it was affordable. And then finally, which continues from that a little bit, just balancing. People spoke about balancing the risks of financial advice and financial products, but also the reassurance that gave. And this is where you need to know what an immediate needs annuity is. So that's that upfront lump sum payment in order to get a smaller amount per month back to pay for care. So what Jane says about her mum, who was self-funding. So her mum bought an immediate needs annuity. So the annuity took about 1/3 of her mum's estate to pay for the annuity, and it guaranteed the continuing payment for as long as she needed it, so the rest of her life. And then 2/3 of the estate was then protected for the children to inherit. The break-even point on the policy would have been for 4 years. Sorry, I got distracted by the comment then. The break-even point on the policy would have been for 4 years, and she didn't live that long. She lived 18 months. But as far as I'm concerned, and I know she would say the same, it was absolutely the right thing to do for us as a family because it gave her peace of mind. So the annuity cost the equivalent of 4 years worth of care, but her mum only lived 18 months. So if she hadn't had the annuity, that would have cost 18 months of care. So financially, they were out of pocket, but Jane felt that it gave her and her family peace of mind because they knew that it wasn't going to cost any more than that, and that 2/3 of the her mum's estate was protected for inheritance. So just quickly to summarise and say what our next steps are. What we will have produced in the next few months at least is this online peer experience resource for self-funders and for professionals to use as well. What's new, we'll be working on some of this a bit more. We've got another 3 months left of the project, but from what I've spoken about today, what's new I think is the wide range of bringing together the wide range of topics that are really important for self-funders and bringing them all together in one place. And some topics I think we haven't really thought about before, like the lasting powers of attorney and the wills and some of the issues around families. I think the additional dimension that paying for care gives to the discussions that families have, the emotional implications, and just adding that extra layer of complexity to all the decisions that people need to make, whether or not they pay for care, but actually paying for it adds a little extra to each of those decisions that people have to make. And we've learned more about the experiences that people have with seeking financial advice or the reasons why they don't, and with financial products. And also for me, it's reinforced the importance of peer experiences. The participants in this study were very glad and very willing to share their experiences in the hope that they could help people in the future to learn more and to help their journey through the social care system as self-funders. So the next steps for us is testing the demonstration version of the website, which will be in April. And then later on this year, late summer, I think, is when the self-funders module on the Social Care Talk website will be launched. So just finally, thank you to the study participants and to our public involvement group and our advisory group for the project, and to our funding body, the NIHR. And here are some links. So a link to the Social Care Talk website, so you can look at that when that is built, and how to contact me. And then the final link there is for the project website on the SPRU at the University of York's web pages.
Thank you very much, Kate. That was really interesting and a very important project, I think, to really start to open up the box of what's going on when individuals and families are making these really important and difficult decisions and facing sometimes choice, but sometimes also a situation over which they have limited control in terms of how they're spending their resources and how they're arranging their care.